When people get back pain, they want to know what is causing it. They may have been told different reasons in the past, such as it's your age, or you've got weak muscles, this joint is out of line, your pelvis is out, you've got one leg short than the other one. There's lots of different reasons that have been told to people who've got pain. In our heads as human beings, we like these simple explanations. Oh, I've got pain because I've got these weak muscles. And it makes it sound like there's easy solutions and a single solution. Unfortunately though, with back pain, that's simply not the case. Back pain's multifactorial, and it's very rarely due to one specific factor. A really good analogy I like to use to help to explain this is the cup analogy. I first heard it from a Canadian chiropractor and physiotherapist called Greg Lehman, and I found it's actually the most useful, beneficial way of explaining how multiple factors can contribute towards our pain experience. In the cup analogy, we all have a cup or a glass, and when that glass gets full and starts to overflow, that's when we experience pain. There's lots of different things that can add water to this glass and cause it to overflow. Aspects such as our age, genetics, any wear and tear, we know that they can contribute towards pain, but by themselves they're not sufficient to give someone pain, but they go into the cup or the glass. Other things that can go into the glass are factors such as our posture. If we've got tight or stiff joints, maybe we've got some weaker muscles, as well as stresses. Physical stress, such as an increase in physical load, if you've been doing gardening when you're not used to doing it, or some DIY for example. As well as physical stressors, we also have psychological stressors. Stress itself has been linked to pain. It has a physical effect on the body and it can increase the level of pain we feel. And the same is true for anxiety and worry. So these things can add water to that cup. Then there are factors related to our lifestyle. Poor sleep, a bad diet. These types of things, again, are related to pain and have been shown to be correlated with increased pain. So they can add water to the cup. Eventually, the cup gets full and it overflows, and that's when we experience pain. It's not necessarily down to one specific thing or one specific factor, but rather it's a contribution from a few different factors that will then top that cup up or that glass up and cause it to overflow. When we're in pain, we want it to go away. That's why people seek out my services as a chiropractor. It might be why you're watching this video now. And if we're going to stand the best chance of getting the best outcomes, we need to look at all of the things that have contributed to that glass or that cup overflowing in the first place. Some things we just can't change. We can't change genetics, we can't change your age. But there's plenty of things that we can change. We could do some exercises, some stretches on muscle groups. We could even do some manual therapy on certain joints. But we also need to look at what other factors are going into that cup. What psychological factors? Are there any stress, anxiety? What lifestyle factors? Have you got really bad sleep? How's your diet? Because all of these things can contribute to that cup and cause it to overflow and cause pain. The final thing we can do is get you a bigger glass. If we can get you a bigger cup or a bigger glass, you're better able to cope with some of life's demands and not experience pain. Your glass doesn't need to be completely empty. You could get a bigger glass or a bigger cup.